What effect does insulin have on your POTS symptoms? If you're like the average patient with POTS, what are you dealing with, right? Fatigue, lightheaded, dizzy, maybe you're passing out, headaches, focus and concentration, mood issues, and much more. Go to the doctor and you leave frustrated, right? You get medications, told compression stockings, salt tablets, and other things like that, which may or may not help you to an extent. But we have to remember when we're looking at POTS, this requires a whole body approach. Now, one of the things that I see quite often with POTS patients is they have issues with insulin. Now, this is a test that isn't that expensive at all. Okay, it's a blood test, but it's also a test that's not being ran. So what happens, right? You go to your doctor, they're going to do basic labs, and you're usually told your labs are normal, which leaves you frustrated, right? So part of your basic labs is they are looking at glucose. And they are saying, hey, look, your glucose looks okay, or maybe it doesn't. But why is this not really the best thing? Well, the thing is, when you have exposure to glucose, you need to take glucose up into your cells. So when glucose goes up, you then have your pancreas is going to cause production of insulin to go and help this blood sugar get into the cell. So now as your insulin goes up, your glucose will start coming back down. Now, this is something that I see all the time where they come in and their fasting glucose is still between about 90 and 100, maybe it's slightly above that. But what will we see? Their insulin is above lab high. So most labs you're looking at about 20 to 25. Now, if we're really looking at health, you want your insulin less than 10, okay? It really should be. But I get plenty of people who are in the 30s and 40s. So now every time they eat, shortly after that, now all of a sudden they become tired, they become foggy, they become dizzy, they can't focus, concentrate, mood changes, and other things like that, which we're going to go into why this happens and why it matters with POTS.